Look at the hip here. Hip, ankle, knee, the spine, they all kind of interact with each other. So when we look at a very broad picture, we have a pelvis, a femur, and then we have a tibia and a fibula. There on the outside, the fibula is a little small guy on the outside. We're going to start at the hip because the hip is one of those things that requires a lot of attention. It requires a lot of focus on what's going on because it does so many different things. The hip is a ball and socket joint, but then also when we look at the pelvis and how it interacts with the sacrum, so there's sacrums back here, it's basically a gliding joint. So when we look at the hip, we're looking at two different sides of the pelvis. So they alternate inside. So when we look at how they function and how we train them, we have to consider what's going on at the pelvis because the pelvis can tilt anterior and posteriorly depending on what you're doing. And then the bone, the head of the femur here, basically the head of the femur can rotate within a ball and socket joint. So when we take a big overview, two big things to notice because we're connected here by the pubic symphysis right in the middle, which is basically just cartilage. The pelvis moves freely when we talk about doing any kind of movement. So we'll talk about each little thing as we go. Adding the muscular system in there, okay. What we really want to look at here is how complex this hip gets. So on the we're going to start on the posterior side here. On the very outside, we have our glute max, so that's your butt. Tends to be the one thing that people like to talk about. On the side of the hip, we have your glute med. So when we look at the glutes, we look at the striations here. If you look at how those muscle fibers line up, one of the big things that's going to happen is it's going to be responsible for hip extension. So basically we're attached to the top of the femur and then around the edges of the pelvis. So especially really like the top spine per se. Underneath the glute, we start to get into more of these rotators. So these muscles in here, your piriformis, one that commonly gets pretty tight on people, the gemellus, the obturator, the smaller gemellus, or the gemellus inferior, and then your quadratus. And we can even go then your iliacus, your ischiocecal, I can't even pronounce it. A lot of times we don't look at these as much. These are more pelvic floor muscles. If we wanted to look at pelvic floor, we're not going to do that as much because they're harder to train. But we start to look at different things. So right here is the head of your femur. So we can see, especially when we look at the obturator and we look at the piriformis, those are going to externally rotate that femur, and then they're going to cause a little bit of femur hip abduction, so abduction out to the side. When we start to look at the front, actually let's look at the side here real quick, because then we look at your glute med. Your glute med acts as an adductor as well. Then we start to get to the front, and we can cut away some of these things. So if you ever hear about your IT band, that's this guy, your tensor fascia lata, and basically it kind of comes down to form the IT band that runs over your knee. A lot of people get very, very tight there, or at least they feel some kind of tension or tightness. That right there is an extensor, so that's a quad, part of the quad muscle. When we actually look at the quad and what kind of goes